Hello, Anatoly. My name is Cassandra. I'm going to be doing your focused cardiac assessment today. Can you tell me, do you have any concerns about your heart health at all at this time?
No, my heart has been okay.
Okay. Do you have any history of heart disease?
No.
Any hypertension? Do you have a family history, like one of your parents? No? Nobody has anything? Oh, that's good to know. Good for you. All right, so I'm going to take a look at the client. First, I'm looking at his skin color. Everything looks, I don't see any like cyanosis or pallor. Everything looks nice and well oxygenated. So looking at my inspection, I did my health history with the client. The next thing I'm going to want to do is have the client lay down at a 30-degree angle so we can check jugular vein pressure. So if you can just lay back on this little exam table I made you, sit up a little higher so it's more like a 30 degree. There you go. So what we're going to do is somehow make it so your head can lean back. There you go. You can relax your back. So I'm going to have you turn your head so I can see this side and this side, and I'm going to look for a pulsation. And we're going to use a card to measure where we see the pulsation, which is a little too big. And we're going to use a ruler at the sternal angle to measure. And we're right at about 2 centimeters, which is good. If we were measuring over 3 or 4 centimeters, this would indicate that the client has some aortic insufficiency, possibly stenosis. And also, if it was measuring low, like at the sternal angle, that would indicate that there's possibly dehydration, hypovolemia. So while I have my patient in this supine position, let's climb up because I'm short, I'm going to assess the carotid arteries one at a time. First, feeling for a pulse. And what are you guys doing? We're doing, thank you. Sorry. And we're just feeling for any thrills on both sides. Feeling for the rhythm. And then with a client of middle age or older, we always want to check for buoys to assess for any atherosclerosis. So I'm going to listen with my stethoscope for any whooshing sounds.
No, it's not.
Which I luckily do not hear. So next I'm going to continue my assessment, and I'm going to feel with the palm of my hands for any thrills. It could be like a vibration. And then use the palm of my fingers to feel for any heaves or lifts. I'm also, guys, can you please be quiet? I'm also feeling for any lifts with the top of my fingertips. I don't feel any lifts. That would indicate that the client has hypertrophy of either of his ventricles. So now I'm going to listen to his heart sounds. Guys, can you please be quiet for 5 minutes because I'm trying to do my homework. Look, mommy's doing homework. Can you please give me 5 minutes? Okay, you can tell me in 5 minutes. Kyle, Connor, please. Go sit down, please. I'm going to start at the aortic valve. Listen for a full cycle. I hear S1 and S2 with no extra heart sounds. Move over to the pulmonic valve. I'm also listening for any inspiratory splits in this area. When he inhales, sometimes you'll hear a slight split of the S2. Move to Earth's point. Listen to the tricuspid valve, the point of maximal impact, and the mitral valve. to assess for any mitral stenosis, I will have the patient turn slightly over onto the left side to bring the heart closest to the chest wall. And with the bell of my stethoscope, listen at the point of the mitral valve or for any whooshing sounds. With the patient in this position, I will also feel for the PMI to feel for any prolonged or extended pulsations. This patient has an expected finding of a tapping feeling, so we'll go ahead and continue with the peripheral vascular assessment. I'm going to check brachial arteries, which we have a nice full 2+ pulse. Radial. We'll feel on both sides, make sure they are equal. I can see that this client has no evidence of cyanosis in the fingertips. We'll do a capillary refill test. Capillary refill is less than 3 seconds, which is to be expected. Then we'll also inspect the client's ankles for any swelling or edema, which I don't see. We're going to feel for pedal pulses. I'm also going to inspect for any evidence of sores or any brown discoloration, which would imply venous insufficiency, any pallor, the temperature. If it's cold, we're going to suspect arterial insufficiency. We will check the pedal pulses on both sides, which are both 2+ and equal. Check cap refill, and that about sums up the heart.